Well, it's a problem community leaders say has existed for generations, a lack of healthcare providers who represent the different cultures of America.
That's right. In our series called Two Americas, we're showing you different perspectives and solutions to community issues.
As WPTV News Channel 5's Tori Dunnan reports, one local group's working to break down barriers to help people in our community.
Mom, like mom.
Mom, that's Olga's native indigenous Maya language. She speaks English now plus Spanish, but says when she arrived here,
It's too hard. When I get my pregnant,
it was not easy.
you can get access to what you wanted. Sometimes when you go there, nobody can help you.
Francisco Felipe didn't speak Spanish or English when he came here.
I speak the Mayan language. I was spoken It's kind of hard, to express yourself, to not speaking Spanish or English.
Access to health care was a big problem.
You don't get access to different programs because of your language. You cannot able to have a conversation about that thing that you need with other people because they only speak Spanish or English.
Mariana Blanco, the assistant executive director of the Guatemalan Maya Center, just presented to a group of health professionals who work directly with farm workers or serve the migrant population, touching on the topic of language and cultural barriers.
Working with the indigenous population, and when talking about healthcare specifically, we have to recognize that Spanish might not be their main language, and specifically the Guatemalan Maya community. There are 22 recognized languages.
Blanco says
It's long overdue.
They're tackling this problem with their own healthcare clinic.
With somebody that speaks their language, with translators, in that comfortable environment where they also feel, that we're culturally sensitive.
The hope is to have this mobile health clinic up and running by the end of the month of May. It'll take place here at the Guatemalan Maya Center. They say it's important that access happens after hours and also specifically here at this location.
Access for our people doesn't mean 9 to 5 hours. It means 5 to 8 or 5 to 10. Our people, for the most part, are living day to day, and they cannot afford to miss a day's work to take care of their health.
But the goal goes beyond their individual organization. They say it's essential to empower the community to be proud of being Maya.
What we're seeing now is that a lot of the children don't want to learn their native languages because of a lot of the bullying or a lot of the trauma that they've had in growing up being Maya. Maya was not a term that was positively used in the past, and so we're still getting rid of that stigma.
That, in turn, she believes will lead other essential agencies to hire indigenous staff. What happens when there isn't access to health care? There aren't people who speak these indigenous languages to treat sick people within our communities.
It's kind of a domino effect. Having a clinic here at the heart of Lake Worth, where we've been established for over 30 years and we're known, we're trusted, is a game changer.
Thank God it's here for the community. So it's I'm excited to come here.
Tori Dunnan, WPTV News Channel 5.